yourself if these myths are true. Do you know exactly what HIV is? Unfortunately, 1.1 million people in the United States are living with HIV and 33.4 million worldwide. HIV has become one of the most serious health concerns internationally, with HIV being a huge concern and topic in our lives. Do we really know what HIV is and how it is caused? Human immunodeficiency virus, or as we know it, HIV, is a virus that causes AIDS. It is an incurable sexually transmitted disease that attacks and weakens the immune system. HIV can hide in the cells in your body and attack your T cells and CD4 cells. These cells are used to fight infections and disease, but HIV will invade and use them to make copies of themselves and then destroy them. And how is HIV transmitted? HIV is found in some human body fluids. If these fluids enter the body, then that person will be infected with HIV. The body fluids that contain HIV are blood, semen, preseminal fluid, breast milk, vaginal fluids, and rectal mucus. Feces, nasal fluid, saliva, sweat, tears, urine, or vomit do not contain enough HIV to infect someone. But if they contain blood and have direct and significant contact with someone, then you can be infected with HIV. There are 5 ways these human body fluids can enter our bodies. They are through sexual contact, anal, oral, or vaginal sex. During pregnancy, childbirth, or breastfeeding, mothers can transmit HIV to their babies via amniotic fluids and blood, and after a baby is born, they can be infected by drinking infected breast milk. Also, injection drug use, that is, sharing needles that are contaminated with HIV-infected blood. Also, occupational exposure, that is, healthcare workers are at greater risk since they are exposed to blood and other fluids that can be infected with HIV. And finally, blood transfusion, with infected blood or organ transplants from infected donors. Now that we know how HIV is transmitted, what are the common symptoms of HIV? When infected with HIV, one will experience flu-like symptoms, often described as the worst flu ever. Some of the symptoms include fever, swollen glands, sore throat, rash, fatigue, muscle and joint aches and pains, and headaches. These symptoms can last for a few days or weeks. Though you may have these symptoms, it does not mean that you are infected with HIV. Each of these symptoms can be caused by other illnesses. Only way to make sure that you are not infected is to get tested. Since getting tested is the only way to be sure that you do not have HIV, there are ways to reduce the risk of being infected. The only way to be 100% sure you won't is to not have sex. But if you are sexually active, there are ways to reduce the risk of getting HIV, which are using condoms, getting tested, knowing your partner's HIV status, being faithful to your partner, limiting your number of sexual partners, and when getting tested, there is a 3-month window period. This is a time when the person is infected and the test will detect the virus. The test should be accurate after a few weeks of infection, but in rare cases, it can take up to 6 months. There is no cure for HIV, but there are treatments. With these treatments, people infected with HIV can live longer and fuller lives. There are over 30 drugs that have been approved to treat HIV. Some common ones are the cocktail and ARVs. There are 5 different classes of HIV drugs. Each class is used to attack the virus at different points in its life cycle. Not all treatments are suited for every patient. To find the suited treatment, you have to contact your physician. Now that we know what HIV is and how it is transmitted, what can we do to help? There are many organizations that bring awareness and fund programs to find cures and better treatments. One of those that you may already know of is Red, which was created by Bono and Bobby Schreiber in 2006. The song that is playing is by the band U2, called Invincible Red Edit version, which they released earlier this year to fund this cause. The main thing a society can do is to bring awareness and educate those that do not know about HIV.